Let me introduce a bit about the Saffron Gin. Actually, you don't have to use gin. Any hard liquor would be fine. Any liquor made from grain is okay to use as a base to make saffron liquor. Gin is made from juniper berries. It's the fruit of the pine tree. Juniper berries enter the heart channel. This liquor is excellent for any cardiovascular diseases. My TCM professor said that in case of an emergency such as high blood pressure, you can quickly give the patient a shot of gin. In 2 hours, the high blood pressure would decrease 30 to 40 points. And then send the person to the hospital immediately. Don't drink any more. It's a very effective liquor with a very strong medicinal effect. Gin smells good but doesn't taste good, so there are many versions infused with other flavors such as lemon, cucumber, etc. I don't recommend the ones with the extra flavors. The purpose of this is to make it more palatable and smooth. It's better not to have them. You can decide yourself, of course. This is my little introduction on gin. Let's talk about perspiration now. Absence of sweating means deficiency of Zheng Qi, which makes the body unable to sweat and push out the pathogens. Therefore, Ma Huang Tang is used to induce sweating. With perspiration, there is still a bit of Zheng Qi in the body, so there just needs to be a bit of encouragement. That's why we need to harmonize the Yang and the Wei levels. When these two levels are harmonized, the body is able to perspire and expel the pathogens. This is the main difference between Guizi Tang and Ma Huang Tang. In an exterior wind-cold excess condition, the pathogenic evil is attacking with full strength. In excess wind-cold condition, there is absence in sweating, severe chills or aversion to cold or wind. Headache. Why? I explained earlier. The entire body is being attacked by the cold, especially from the front of the head, following the bladder channel down to the neck. So, the entire skin and all muscles from the head and neck area will be contracted due to the cold. So that's why the headache is usually present. The pulse, due to cold invasion, will be light. It's like a stiff water hose. Tight and forceful. Fever may or may not be present, depending on the time frame. Usually at the beginning stage there is no fever. Why is there fever later? The body wants to perspire to expel the pathogen, but it can't. What's the purpose of perspiration? To dispel heat. Whether or not there is fever depends on the disease progression. According to Zhang Zongjing, disease progression may not follow the usual pattern. You need to decide the excess and deficiency of the pathogen versus the host. Formula prescription will also be dependent on your diagnosis. Whether or not there is fever is dependent on the severity of the pathogenic evil and the length in which it has been stuck in the body. Heat disappears when sweating occurs. Same with Ma Huang Tang, once sweating occurs, the fever breaks. So, what's in this formula? Ma Huang, Xing Ren, why? The bitter and cold nature can ventilate the lungs and relieve asthma and dyspnea. What else? Xing Ren can also prevent Ma Huang from overventilating. There is also Gan Cao. Excessive heat can also cause pain. This is taken care of by Shi Jiao. There is a little bit of Zhui Zi here too. This part here is a mistake. This is Gan Cao, and this is Zhui Zi here. Zhuizi is here to harmonize the yin and wei levels. When the pathogenic evil is in the exterior, you can use this formula. The sooner, the better. Ma Huang Tang can even be used when the heat invasion is very sudden and it's in both the Taiyang and Yang Ming stages. If the heat is invaded even further, you can use other formulas like Zhi Zhen Tang or Zhi Zhen Huang Qin Huang Lian Tang. In the US, I understand that Ma Huang is banned, so instead, you can use Qiang Huo, Jingji, or Fang Feng, or during the Ming Dynasty, it was discovered that something can replace Ma Huang Tang. It's food, actually. In the Taiping Huimin formula book in the Ming Dynasty, 2 of the most commonly eaten foods. Anybody? Scallion. What else? Scallion with ginger or scallion with du qi. Kong Qi Tang can replace Ma Huang Tang. Isn't it great since it's safer? Or you can just use scallion with ginger. What's the purpose of Dan Du Qi? Very similar to Zhuizi, scallion is responsible for the dispersing effect. Dan Du Qi, like Zhuizi, can regulate the yin and wei levels in the GI system. Dan Du Qi has a slight tonic effect that can strengthen the body to induce sweating. Don't confuse Xian Du Qi and Dan Du Qi. They are different, although both are Du Qi. Xian Du Qi has a binding effect. That's wrong since we want to disperse in an exterior condition. I saw both in Chinatown the other day. Next, we have exterior wind cold with deficiency. This is Zhuizi Tang syndrome. Yin and Wei disharmony with Wei Qi deficiency. Aversion to wind or cold, chills are the chief symptoms. Does Ma Huang Tang mention aversion to cold? Yes, right? But Ma Huang Tang syndrome also has sweating while Zhi Zi Tang syndrome does not. The body has the ability to perspire. What's the problem with that? The problem is that the patient will become even colder as the Zheng Qi becomes even weaker after the perspiration. So what did Zhang Zongjing say to do while serving this formula? How about Zhuizi Tang? What were the instructions? How do you serve Ma Huang Tang? How about Zhuizi Tang? Which one are you supposed to drink? One whole bowl at once. How do you serve Ma Huang Tang? Don't know? Zhuizi Tang should be served with congee. What if you don't have congee? How do you serve Ma Huang Tang? This is a great tip in case you don't study this in school. Zhuizi Tang is supposed to be served all at once, the entire bowl of decoction. But not Ma Huang Tang. Ma Huang Tang is supposed to be served hot but in small sips. And when light sweating occurs, one should stop to prevent oversweating. So the patient doesn't have to finish all the herbs. Also, just sweating once is enough. Oversweating may injure the body's Zheng Qi. If you serve this wrong, patient may overperspire and make the condition harder to treat. Let's say you gave too much Ma Huang Tang and the patient overperspired. What do you do? Use Zhuizi Tang or Xiaojian Zong Tang. Why? To stop and bind, of course. In some cases, you even need to use Zhen Wu Tang. So, Zhizi Tang should be served all at once. Drink the entire bowl of decoction and then serve hot congee to induce sweating. The purpose is to quickly restore the Zheng Qi. Zhuizi Tang is for deficiency type of wind invasion with perspiration, aversion to wind, nasal discharge, dry heaves. It can also be used for neuralgia due to wind. Zhuizi Tang can treat systematic neuralgia by relaxing the muscles and treating spasms. Both Zhizhen Tang and Zhuizi Tang can treat muscle stiffness and pain. Huang Qi Wu Wu Tang is Zhuizi Tang with Huang Qi. Bai Shao is removed so qi circulation can be enhanced. This can even be used for morning sickness due to cold. The variation of this formula, Zhuizi Long Zhu Mu Li Tang, can be used for neurasthenia. Next, let's talk about wind heat invasion. Wind heat is considered Wenbing, febrile condition. In the Ming Dynasty, publications of febrile diseases start to appear. Then in the Qing Dynasty, the idea of febrile condition was very prevalent. Wind heat in the beginning is still an exterior wind condition. Because of the wind factor, initially patient will still have an aversion to wind. So the key is that the patient is very afraid of wind exposure. Also, there would be a slight fever or heat sensation. Why is that? Is this exterior excess or exterior deficiency? Sorry, I meant is the pathogenic factor strong or weak? Up here, we have pathogenic excess, and down here, deficiency. When pathogenic factor is in excess, wind condition will be present. So that means that even though this is the beginning of a febrile condition, there will still be aversion to wind. In some cases, there may also be aversion to cold, but it's not obvious because there is also a presence of heat, which overshadows the aversion to cold symptom. Over here, there may be some aversion to wind or cold, but the prominent symptom is low-grade fever. Here, it says absence or slight perspiration. Fever here is higher. How about here? Would this patient have fever? Not really. There will only be thirst. There is sore throat for the top case, but no sore throat for the bottom case, so we can use Yin Kiao San for the top case. You can also use Sang Zhu Yin. So this is wind heat condition or beginning stage of febrile disease. The conclusion is to use Yin Kiao San for strong wind heat invasion and Sang Zhu Yin for weak heat conditions. So again, wind heat, beginning of febrile disease, will have aversion to wind, sometimes cold, if the heat is not severe. Other symptoms include fever or heat sensation, headache, and possible sweating. How about the pulse? In wind cold, the pulse is superficial and tight. In wind heat conditions, the pulse is superficial and rapid. Yes, superficial and rapid. How about Zhuizi Tang? Superficial and slow. So, wind heat is superficial and rapid. The composition of Sang Zhu Yin is very similar to that of Yin Kiao San. It's very similar. What's the difference? Sang Yi and Zhu Hua both have Lian Cao. There's no Niu Bang Zi. Bai Mao Zhen. What else? It doesn't have the strong heat-clearing detoxifying herbs. It doesn't have the herbs to relieve pain either. Why? Because this is the beginning stage of febrile diseases, and because the pathogen is not that strong. In other words, the condition is mild, so the herbs needed are only those that ventilate the lung, clear a little bit of wind heat. Sang Yi in this formula is used to ventilate the lung. Sang Yi is used to ventilate the lung and arrest cough. The chief complaint for Sang Zhu Yin is cough. There are no other more severe symptoms. Slight fever or heat sensation with thirst. What is the tongue coating? Thin white or... What's the tongue coating for Ma Huang Tang and Zhuizi Tang? Same. White. Right? Here it is, thin white or thin yellow coating. Yin Kiao San patients will show more thin yellow coatings. There isn't that much heat yet in Sang Zhu Yin patients, so the thin yellow coating won't be that bad. Normal people have pink tongue with thin white coating. Pulses floating and rapid. This formula doesn't have to be restricted to only wind heat conditions. It can also be used where there is dry or itchy throat due to heat, not necessarily wind heat. Especially during summer, I use this formula, Sang-Ju Yin, a lot. There is Bai Mao Zhen in the formula which can nourish the yin. Sang Yi and Zhu Hua, both clear heat. This is Yin Kiao San. It has high doses of Jin Yin Hua and Lian Kiao. It contains Dan Du Shi and Yu Bang Zi. It promotes eruption and surfacing of toxins. It contains herbs that relieve pain, promote sweating, and also clear heat and detoxify. When heat is even more severe, Qing Ying Tang needs to be used. Herbs in that formula are ones like Zuan Shen, Sheng Di Huang, etc. At the beginning of febrile diseases, the treatment protocol is still to expel the pathogens by releasing the exterior. When I was in school, I was already treating patients without a license. After 1 year of being in school, I started to see patients secretly. I never studied because I never had time to study. Every day I was seeing patients. I was so cocky that I told my patients with common cold that they would get a full refund if they didn't experience any symptom relief in 15 minutes. If you tried it on yourself, you would know how effective Chinese herbs can be. When I became licensed, I did the same thing. I once gave a patient a 3-day dose of herbs for a common cold. The next time he came by, he asked me if I added any Western meds in the herbs because the effect was miraculously fast. He said he was cured in 1 dose. For any acute problem, you can see very fast results if you prescribe correctly. Many patients falsely believe that only Western medicine can work very fast. He recovered so quickly because the exterior releasing effects of the herbs. I also instructed him on how to take the formula. I always tell my students that it is very important to instruct the patients on how to take the herbs. It's not as simple as just giving your patients herbs. So this is why I went into details earlier on how to take Ma Huang Tang and Zhui Zi Tang. What if the patient also has summer heat stroke? What would be your serving instructions? It's a real shame if you don't instruct patients properly in order to maximize effects. I have a question for you. Should diaphoretic herbs be taken on an empty stomach or after meals? Raise your hand if you think it should be done on an empty stomach. How about after meals? Empty stomach. Also, should Yin Kiao San and Sang-Ju Yin be served hot or after the decoction has cooled down? What? Hot or cold? Or warm? How do you cook this formula properly? Most of us use herbal extract powder or capsules nowadays, so this question is not applicable. But if you prescribe raw herbs, you need to tell patients how to cook the herbs too. If you cannot instruct them on how to correctly cook and take them, the effect is severely compromised. Additionally, if you use herbal extracts, how can you tell the quality since it's all in powder form? Anybody? The way to do this is to open the bottle and let it sit for a week. Good quality herbal extracts will still have a therapeutic effect. The bad ones won't taste the same after just 1 day. It may taste just like sugar, since many suppliers from China use maltodextrin as a binder. Why? Your herbal vendor, whether from Taiwan or China, should happily show you their factory and how the herbs are produced. There are some top herbal companies in Taiwan that just cannot give a discount. The reason is because they spend a lot of money on equipment to test and extract the volatile oils. The extraction of the volatile oils, which is the active ingredient, is added back to the end product instead of being evaporated away during the cooking process. Do you remember back in school when you studied exterior releasing formulas? Whether they needed to be cooked with low or high heat? High heat, with the diaphoretic herbs to be added at the end. What's next? Low heat? No, wrong. After cooking with high heat, you are to pour the decoction out into a bowl, cover it with a lid, and drink it when it's not as hot. Why is that? The active ingredients with the exterior releasing herbs are the volatile, fragrant oils. So how long do you think your herbal company cooks these herbs? Your herb company is cooking 100 kilos as opposed to your 12 grams. This is a completely different concept. Of course they will cook it longer, right? What about the volatile oils? You can smell some of the volatile oils in the factory. Just like my assistants who are cooking the herbs at my clinic, they rarely get sick because they are smelling the volatile oils all day long. Active ingredients are in the volatile oils. Really? I have only seen 2 companies out of the ones I have visited where I actually saw the volatile oils retrieval system at work. One of them is Quali Herbs and the other is Evergreen Herbs. Up to now, these are the only 2 companies that have essential volatile oils retrieval systems. What? Sun 10? They don't. At least I didn't see it. There are only 2 factories with true volatile oils retrieval systems. Sun 10 doesn't have it. This is why Quali Herbs and Evergreen Herbs cost more. I will tell you a story. This happened in my TCM school hospital. The clinic director thought he could lower the cost of herbs by having the vendors participate in a bid because he had heard from a colleague that the price could be 70% lower. He had the vendors bid, and at the end, both Quali Herb and the factory that supplies Evergreen Herbs backed out. I later found out that this was because the raw material cost was already higher than the price in which other factories were willing to sell at a 70% discount. 3 months later, there was an emergency meeting. Why? Because more than half of the patients had dropped out. Patients don't come back because the herbs are not working. The meeting was to evaluate the reason for this. It was determined that the quality of the herbs was to blame. It's the same case with the franchise clinic I work for now. The owners sometimes don't believe me when I request to use Evergreen's herbs because they know I am good friends with the distributor. You need to try different companies and find one with high enough quality that truly works well for your patients. One of the owners of my clinic was convinced by a supplier on the effectiveness of their herbs, plus they could give a better discount. To make a long story short, later on we had to dump all those herbs. I told the owner. I'd told him so. And then I suggested to him to buy Yin Kiao San from 3 different companies. Label them supplier 1, 2, and 3 so no one knows which company they came from. I asked him to let every doctor in each of his franchise clinics test the quality of the 3 formulas and choose which one that they would use. The general manager objected and said that nobody tests herbs this way. He knew that the herb company he liked would come out last. He didn't want to try it. Sun 10 was the company he liked. Sorry, I'm not supposed to point out any company. Let's just say there are 3 companies. So I want you to do this test at home as well. Buy Yin Kiao San from 3 companies. You don't need to open the entire bottle for 3 days. Just pour out 10 grams from each bottle. 3 days later, compare them by smelling and tasting them. You will know which one is best. Honestly. Raw herb powder costs more than the extract powder that can be discounted at 70% off. Let's say 1 bottle of CEUs is X amount. I say X amount because I don't know how much it's sold for here. Let's just say 1 bottle. 100 grams of extract powder is $20. but the raw herb cost of 600 grams is $80. So let's do some math here. $20 for 100 grams of extract and $80 for 600 grams of raw herbs. Does the supplier need to make money? Yes, of course. How about shipping, packaging, etc.? So let's just say the cost is $12 per bottle. So at $8 times 6 equaling 48, my raw herb cost is $80. How is that possible? Yeah. What do you think you are really buying? The cost of the extract powder is lower than the cost of the raw herbs. How is that possible? So what's inside? To tell you the truth, many herbs from China are like this. I know this because when I lectured in China, the sponsors were herbal suppliers from China. They tried to convince me that their herbs are better than the ones produced in Taiwan. They tried to convince me by saying that the extracts from Taiwan, after mixing with water, still have cornstarch residues, while ones from China can completely dissolve in water due to their high concentration. Ah! It dissolves because the binder is fructose. Fructose is only slightly sweet. What binder does Taiwan usually use? Cornstarch, because it dries quickly and interferes least with the herb effect. Many suppliers from China will tell you they have super 10-to-1 concentration ratios without excipient or carriers, and that's the reason their herbs can dissolve completely in water. Ha! Don't be stupid, okay? Really, don't be stupid. Ask your supplier if they dare to show you their factory. There are not too many suppliers that will welcome you to their factory or tell you the truth. Why do I know this? Because I started visiting the herb factories while I was in TCM school. After I became licensed and was invited to China to speak, I also visited their herb factories to further my understanding on the manufacturing process. Honestly, as a doctor, you want your patient to be healed as quickly as possible. That directly affects your reputation, right? So don't shoot yourself in the foot by using poor quality, cheaper herbs. Same with needles. Don't use poor quality ones. One very famous old acupuncturist in Taiwan once did this. You would never believe it was him, because he is so famous. He used some no-brand, low-quality needle to needle Huan Tao, GB30. The needle got stuck, so he had to call his surgeon student to come perform a secret surgery at 10:30 in the evening. Then he paid the patient 300,000 NT, which is about 10,000 US dollars as compensation. I like to use needles with handles that are coiled by hand. Why? Because my hand has been accidentally needled many times. Imagine that. I don't even use a tube. Just using freestyle, I have been accidentally needled many times. That really tells you that inexpensive goods usually aren't such good quality. Be careful. You are a doctor. Trying to save a penny now may cost you even more later. I read a ridiculous article once. It says the patient doesn't need to worry about broken needles in the body because over time the body will absorb it. I'm telling you what was stated in the article and what was being taught previously. I was thinking to myself that we should just put in more needles so we can all become transformers. Back to herbal formulas. Jin Yin Hua is a flower, so it has volatile or essential oils. Liao Kiao is a seed. Bo He also has volatile oils. Jingji Sui. What's the difference between Jingji and Jingji Sui? Jing Sui is the flower of Jingji. This is the portion that has the highest amount of volatile oils out of the entire plant. Some herb companies will tell you they use Jingji Sui. Some will say Jingji. By Jingji, some will use the entire piece of Jingji. Some will use just the twigs. Not even the leaves are used. How effective do you think it will be? What's the price difference? Jingji Sui is 3 or 4 times the cost of Jingji. Sometimes my colleagues wonder why my formulas work so much better when most of the herbs prescribed are the same. Quality of herbs. Also, I teach my patients how to cook the herbs if they are taking raw herbs. If they are taking extract powder, I teach them how to take it for maximum effect. Serve warm, right? What else? Should we do something to induce sweating? If there is absence of sweating, then definitely. When the pores are opened, wind is expelled. Then the patient will recover faster. So in any exterior condition, even if there is slight sweating, you need to induce more sweating to expel the pathogens. How do we instruct the patient to induce more sweating? Drink congee? Use a blanket? Wear more and keep warm. They must do this and prevent catching another cold. What did Zhang Zongjing say in Shanghan Lun? Once mild sweat is induced, it must be wiped off and new clothes must be put on. Many people do follow the instruction to induce sweating. However, after sweating, they will shower using cool or cold water. What do you think about that? If one can recover like that, then ghosts exist too. These cautions and contraindications need to be conveyed clearly to your patients. The more clear your instructions, the better the therapeutic effect. Do you think acupuncture can induce sweating? Yes. So do you just let them leave your clinic wet like that? Think about this. Do you let them leave like that? So the main ingredients of Sang Zhu Yin are Sang Yi and Zhu Hua. These two herbs are not in Yin Kiao San because this formula is aimed at treating mild wind-heat invasion only. Jing Ren is used to arrest cough and descend lung qi. This formula strictly just releases the exterior. There isn't much going on in the deeper levels that needs addressing. Based on Sang Zhu Yin, Yin Kiao San has additional herbs that are stronger, such as Jin Yin Hua, Mu Bang Zi, Bo He, Jing Ji, Dan Du Qi. These two are actually very similar formulas. In school, this is what I hated the most, having to pick out the similarities and differences between formulas. I hate questions like this. Compare X and Y formulas. List the herbs that are the same and the herbs that are different in the two formulas. Drove me crazy. So much memorization. What's the purpose of this formula? Release the exterior. And additionally, to clear heat by using what? Jingji Sui with its effective volatile oils as active ingredients. Also, Dandu Qi enhances the dispersing effect. This formula is great to detoxify the tonsils. Which channel passes through the tonsils? Yes, stomach. Why do you think stomach flu patients always have inflamed tonsils? There are even white dots or ulcers in the mouth. So in cases like this, you need to pick herbs that clear heat, detoxify, and enter the stomach channel. The best formula for this is Liang Ji San. Where is Ji? Here. Or you can use Qingzin Li Gi Tang. This morning, I woke up at 7 a.m. and was checking my messages. One doctor from Taichung texted me and said that he has a patient that has a cold with a high fever. He said that this patient had been under my care previously. The patient went to see him despite the heavy rain and flood. He said that the patient went home with 3 packs of herbs, but the odd thing was that even before he arrived home, he was cured. Both the patient and the doctor thought it was a miracle, but it was the works of Qingzin Li Ji Tang. I am telling you this story so that you know the formulas for a pure exterior wind, heat, or cold invasion ought to be different than the formulas to use if the heat has invaded the stomach. What you should watch for is this. Some patients that are extremely weak or are repeatedly exposed to people with colds see the wrong doctor, or take the wrong herbs, and as a result, the Zheng Qi becomes compromised and the patient will contract colds repeatedly. So you must pay attention to those who have exterior deficiency. You have to restore the Zheng Qi while you treat the exterior condition. It's very important you do so. There are many people, especially kids, who, if they have not been to the MD, it's fine. If he or she has, we have to resolve this one problem first. What is it? What do Western meds for common colds taste like? Usually sweet, right? That's because they contain syrup. What does it taste like without the syrup? Bitter and cold. So those kids who have taken Western meds will have this same problem, poor or absence of appetite. Why? Where does cold and bitter go? Hence, most kids will have the inability to digest and absorb. So many kids come in with pale faces and blackness here on the sides. That's an indication that either the kid has taken too many meds or ingested too much icy cold foods or beverages. So many of them. What would you do? Don't know? I told you yesterday. What? Yes, cook fresh or dry ginger. Don't forget this. Why? The concept is just like Li Zong Tang to disperse the cold. I have many parents who bring their kids in to see me because they feel the kids are not growing much. Many times it's due to them taking too many Western meds. Of course, there is also a medical condition called Ganji syndrome. Ganji Zheng. Have you heard of it? If you know how to treat it, you can help these kids for life. What is Ganji? What condition causes it? It's due to excessive nutrition. How do you get excessive nutrition? From the mother or from children's supplements. In case you haven't noticed, many parents are dosing their kids with so many supplements nowadays. The kid's grandmother is the one that I mentioned before who had to take 18 sleeping pills. The dad is a semiconductor factory manager. One time, the grandma brought her 2 kids to my clinic. Because the kids are noisy, the grandma asked my assistant if I could see them first so they won't bother other patients. When I saw the grandma, I told her that her condition was not as severe as her grandson's. I needed to see the grandson first. She completely agreed and asked how I knew. I told her that her grandson has no appetite, constipation, and can't sleep. This expression, seriously, this expression is Ganji. In Taiwanese, the manifestation is very much monkey-like. They look like they are either developmentally delayed or have signs of beginning stages of brain paralysis. In TCM, this is considered Wu Qi Wu Ruan, retardation and flaccidity. The eyes will roll upward, the mouth is open, and they looked retarded. He had no reaction when you talked to him. I told the grandma we needed to treat him first. In 3 months, he would return to normal for certain. She asked me how I could be so confident he will be healed in 3 months' time. I told her it's because it's not a difficult disease to treat. She said that this kid has been to almost all prestigious hospitals in Taiwan and visited no fewer than 10 TCM doctors, but no one could treat him. She said that her poor grandson had to take some Western pills in order for him to have enough of an appetite to eat even 1/3 of a bowl of rice. He had absolutely no appetite. He was 5 years old. He had a cousin who was 3. He was shorter than his cousin. So if you have an opportunity to treat this kind of patient, you can save them for the rest of their lives. In 3 months, he was fine. Later on, I found out they are actually my good friend's neighbor. They said that I was sent from God to cure his son. So how do you treat this? The key points are no appetite, constipation, poor sleep. They are all due to blocked stool. This disease, Ganji, is due to excessive intake of overly nutritious or tasty foods. What do you need to do? You need to purge the stagnation. The body will heal itself. I feel a big part of why some kids are like this is because the mother took too many tonics or vitamin supplements while pregnant. Honestly, it's not necessary. Personally, I teach pre- and postpartum care. My thoughts are similar to that of the OB/GYN. Those OB/GYN who are more honest will recommend the following to their patients. If your patient becomes pregnant, what supplement or tonics would you recommend and for how long? You have these patients, right? What would you use and for how long? If you accidentally overdose your patient and the baby turns out like this, won't your conscience be bothered? How would you tonify? Don't know? You don't have these kinds of patients? So most of the more ethical OB/GYN will tell you to only take supplements or tonics for the first 3 months. Also, eat more big leafy greens. Just make sure there is enough folic acid because during the first 3 months, the brain and the nervous system are developing. So the best time to strengthen is during the first 3 months. What about the other months? Just eat organic natural foods. That's enough. If the kidney is really deficient, then of course you should use kidney tonics. The best ones are Du-Zong and Zhu-Duan. Both of these herbs can also stabilize the fetus. Additionally, Zhu-Duan can promote the production of breast milk too after delivery. I'm serious that this is enough. There are so many kids who can't grow because of over-supplementation. So for most of my patients, I always make sure they can defecate properly first. For Ganji, it's no different. Really, these types of patients can be cured in 3 months. The golden time period to treat Ganji is before 5 years old. It's too bad these kids can't find the right doctor. I'm not praising myself. I am just saying that I have been fortunate enough to have seen a lot of patients since I was young. Some patients ask why I know how to treat so many diseases since I am not an old doctor. I can only say that I started young. I never read books that are published today. I always read the ancient texts. If you completely understand the old text, you will have a much deeper understanding of TCM and be more confident to treat all kinds of diseases. Many people make a mistake of this fact. Do you know how Western medicine doctors saw patients back then? Who are prominent figures of Western medicine back then? Don't know? I'm sure you must know, but you didn't know that he was a doctor. That's all. Who in the ancient text was the first person to weigh an elephant? Don't know? I mean a Westerner. First Westerner who weighed an elephant. Aristotle. He was taking a bath and the water spilled out of the tub, and he realized this same method can be used. Around the same period, Cao Cao's son also thought of the same thing. Even in the Huangdi Neijing, there was something that people suspected. You all know Aristotle and Hippocrates, right? Hippocrates is considered the father of Western medicine. Have you studied the Neijing? Neijing. Qi. What was the description in the Neijing about his appearance? There is a section in the Neijing that says Qi is tall, blonde, and has blue eyes. Yes, really. I am serious. There was actual research on this. So Qi is the Chinese pinyin, right? If his name were in English, how would you say it? Hippo. There were many geniuses who lived during that time. I think we're super beings, sort of like ones that are out of this world. That's why I asked you earlier how you think doctors in ancient Western cultures saw patients. Hippocrates had the four humors theory: phlegm, blood, yellow bile, and black bile. Each was linked with one of the four elements of earth: air, fire, and water, and two of the qualities: hot, cold, wet, and dry. He used philosophy to categorize people and diseases in relation with nature, just like in Chinese medicine. When did recent Western medicine start? End of the 18th century. Why? Because of the invention of the microscope. Also, anatomy and dissection became popular. Therefore, how long is the history of Western medicine? About 200 years, not even 300. Why did Western medicine abandon their old ways of practice? Chinese medicine is closely related to Taoism. What about Western medicine? Religion. So one of the popular reasons why one would contract a disease was because he or she did too many bad things. For example, in the 18th century, the plague destroyed half of the population, and the cause was thought to be God wanting to punish the bad. Is that true? No. What was the cause that's later discovered? Later it was discovered that something like a bacteria was the culprit. Later on, they discovered it wasn't due to mice either. Rat infestation was rampant. Also, who was burned during this era? Joan of Arc. She said the plague was caused by something else. She was burned and charged with heresy, being a witch and pagan. Don't you think ancient Western medicine and Chinese medicine shared many similarities? At the end of the 18th century, all this information was brought into China. Because of this, the Qing dynasty, we started to see the decline in Chinese medicine. If you really think about it, there are many similarities between the two ancient medicines. I don't know what the TCM curriculum is here, but in Taiwan, we have to study both Western medicine and Chinese medicine, but we can only take the license test for Chinese medicine. We actually have more courses in Western medicine than Chinese medicine, yet we can only take the license exam for Chinese medicine. Do you know any old Western medicine doctors? How did they see patients before all the advanced equipment we have today? Have you seen how these old MDs saw patients? Visual inspection and palpitation, right? They had a system called physical examination. How about now? Many MDs don't use this anymore. Why? Many just tell you to get a stool, blood, and urine test when you visit their clinics. Some people joke online that in spite of all this testing, they still don't feel better. What else? They usually will tell you to get further examinations such as a CT or MRI. Why? Many times for profit. Do you really think CT and MRI are that good? Some die right on the CT or MRI exam tables. Why? Because they cannot metabolize the toxins. I truly think Western medicine has forgotten its roots. In TCM, there is palpitation diagnosis, right? Much of what we do in Tcm Palpitation Diagnosis is similar to Western medicine's physical examination by Bell's, the official textbook, except for Chinese pulse diagnosis. So Tcm Palpitation Diagnosis is the same as Western medicine's physical examination. Some of my colleagues use the tapping method as a primary form of diagnosis. They do this to the entire body. Of course, this takes a long time, but the diagnosis is very accurate. So if you look at the Neijing and the Nanjing, how did these books teach us how to take pulses and how to do diagnosis? Any answers? Anybody? Don't know? Pulse diagnosis is the same in the Neijing and the Nanjing. No? What did the Neijing say about pulse diagnosis? How about the Nanjing? Nanjing teaches to take the radial pulse. How about the Neijing? San Bu Zhu Hao, the ancient way of taking pulses. From here and above, 3 sections. From the neck to the groin is another section, and from there on down, another. Each section has 3 subsections. Pulses are taken where you can feel the artery, such as the Fu Yang pulse, and here in the neck is the Ren Yin pulse. So if you examine closely, why are the 2 classics different? Taking the radial pulse is faster. Nanjing also mentions palpitation diagnosis after taking the radial pulse. If you compare the 2 closely, you will find that at the end they are similar. These are 2 different schools or styles. But the funny thing is, at the end, you will find that they reach the same conclusions. For example, in the Nanjing and Neijing, the explanation of the 5 shu points are very similar. In the end, you have to synthesize what you learned from these books and make the diagnosis work for you. A good doctor needs to be clear on all of this. So here, you need to diagnose whether the cold is due to the pathogenic factor being too strong. Or is it due to the patient's Zheng Qi being too weak? For those who are too weak, you need to figure out if they have been through Western medicine treatments. My friend who just left me a message is the father with that daughter who goes to the hospital every week. Really, I'm not kidding. When she came in just before Chinese New Year's, I told him that his daughter would have more severe cough with more phlegm. According to his experience, whenever she started to cough, he would panic. He automatically thinks she needs to go to the hospital because she could have a middle ear infection. I told him she won't have to if she takes Chinese herbs. So he called me on New Year's Day to say that she started to have asthma. I told him not to worry because the weather was changing and that as long as she is still coughing out phlegm, we can continue with the treatment. He insisted that he wanted to bring her to my house. I told him it would not be necessary as she had no fever. I assured him that I would go to the hospital to treat her if needed. I could not possibly attend all my patients at my house whenever they feel there is an emergency, since I see over 100 patients a day. When I first started being a doctor, I never had a vacation during Chinese New Year. For some reason, that was always the time that the King of Cambodia and the minister flew me over to see them. They are my patients. So I never had any Chinese New Year vacation. It's really hard work being a busy doctor. So you really need to know when kids are weak and they cannot metabolize and expel properly. They can't expel the following properly: nasal discharge, defecation, perspiration, and sputum. Many TCM doctors are trying to integrate Western and Chinese medicine. Please tell me, what is phlegm? Some patients will tell you they have no phlegm because they have no cough or nasal discharge. The TCM concept of phlegm is different than that of Western medicine. We have visible and invisible phlegm. Just like the Honghua we discussed yesterday. If you call it Sa-Fu wrong, then there is no problem. If you call Western medicine sputum, sputum, then you would not have the confusion of Western and TCM phlegm. What exactly is the phlegm in TCM when we say someone has a damp phlegm constitution? If you examine and compare the Chinese and Western physiology, substances or fluids that should not remain in the body or cannot be metabolized or excreted by the body are called phlegm. With this definition, it makes sense to say that obese women have damp phlegm constitution. Damp phlegm constitution doesn't necessarily have visible phlegm that can be expectorated. So again, the fluids that remain abnormally in the cells due to the inability of the body to expel them are called damp phlegm. The same goes for substances that can't be metabolized, expelled, nor utilized by the body. In TCM, there is Jin and Yi. What's Jin? Huh? Don't tell me in TCM language. Explain what Jin and Yi are in terms of Western medicine to me. Jin includes all fluids that are functional and useful for the body. Yi is what the body doesn't need, the byproduct of the body such as tears, sweat, nasal discharge, etc. So what's the difference between Tuo and Jian? If you want to spit at somebody, are you spitting Tuo or Jian? Anyone? If you can figure all this out, you can understand the body much better. If you spit at someone, are you spitting Tuo or Jian? Tuo has bubbles. Tuo has bubbles? Haha. Jian is saliva that has enzymes and is useful for the body. Tuo is just the fluid. It's much like semen. There are fluids from the prostate. There is sperm. What part does sperm belong to? Is it Jin or Yi? If you are a Chinese medicine doctor, you must understand the difference. You can use Western logic to rationalize and explain these Chinese terms. Tuo is just fluids. Jian is the good part of the saliva as it contains digestive enzyme and is beneficial to the body. So often in the Chinese language, when something is good, the word yan is usually used instead of tuo, although both terms in common Chinese mean saliva. Much like dragon saliva, we would say that long jian, which is another way to pronounce yan, we would not say long chuo. So that's the difference between the two. Once you understand the real definition, it's hard for patients to challenge you. Tell me why cancer patients always have stomatitis or oral ulcers. Why? There is a reason. Because they have no Jian? Yin deficiency? Then how come they have Tuo? If you say they have Yin deficiency, why do they still have Tuo? Tuo is Yin. Because Tuo cannot be metabolized. Cancer patients can metabolize water. Why is it that patients after chemo and radiation always have stomatitis or oral ulcers? They don't have Yan or don't have Tuo or don't have both? What? They don't have both? No, they do. They have thirst. The theory of Western medicine is that the salivary glands are damaged as a result from chemo and radiation. I actually disagree. I had an oral cancer patient once. When she came to our clinic, she had seen another practitioner first. She told me that she took herbs for a week but didn't see any difference, so she had no confidence herbs are going to work for her. The radiation she received was directly here. After the radiation, she had to drink 3 sips of water for every spoonful of food due to lack of saliva. The entire mouth had ulcers and was extremely painful. The other practitioner prescribed heat-clearing detoxifying herbs for her. The patient said that the burning sensation in the mouth is a bit better with the herbs, but the ulcers were still there. After seeing me, she said she had improved more because she needed only 1 sip of water with every spoonful of food. Also, she said she had a little bowel movement. The second week she came to see me, she had a tissue with her. I asked her what that was for, and she said she now had too much saliva, so she had to use it to wipe it off. In only 2 weeks, Chinese herbs can achieve such effect. Do you believe it? I'm not exaggerating. 2 weeks she was wiping her saliva like this. Her MD was in disbelief and wondered where the saliva came from. So why? Her Jin and Yi were injured, so when the saliva started to be produced, why were the ulcers still there? Yes, there was saliva. Qio was present. Why? Because of Yan. What can it do? It has digestive enzymes to help with digestion. It also has white blood cells as well as antimicrobial agents such as secretory IgA and lysozyme. It can kill germs. When one's body is strong enough, that's when Yan is produced, not just Qio. So when Zheng Qi is enough, Yan instead of Qio is produced, thus the mouth is moistened and the ulcers won't form as easily. Most people use heat-clearing detoxifying herbs for oral ulcers, but a lot of times I use Bu Zong Yi Qi Tang instead. Some will think there are already ulcers in the mouth. How can I give Bu Zong Yi Qi Tang? But the patient will for sure heal since I am boosting the Zheng Qi.